Hello everyone, welcome. Thank you for joining me. In this session, we're going to focus on what's traditionally called a hip roll or hip lift, where you're laying on your back and you're lifting your hips up away from the floor. We're going to go over quite a few options for people. The first thing to talk about is where you start. Generally, you can start on the floor, though you can do it anywhere that feels good to you. If you're lying on a soft surface like a bed, just realize that that's going to be harder to press down through your feet, and it's going to be a bit more intense for the motion to be supported. If you're lying on the floor, your head is the first thing you have to be concerned about. If you're lying on the floor and your face is tilting backwards towards the sky, that is okay to start here, because as you roll up, that will actually not be as big an issue. It's more comfort level when you're laying on your back. So if you're laying on your back and your face is facing away from the ceiling directly, like you can't see over your head in front of you directly, you're looking more to where the wall and maybe ceiling meet, you may want to put a slight little towel or a pad or a small pillow onto your head here, just so that your face can look forward. And then when you roll up, you may not want to go as high, but regardless of what you choose to do, make sure your neck is comfortable. That's all I'm trying to say. So if you're laying on your back and your face is facing away from the ceiling and not looking forward directly, as long as you're comfortable, it's totally orthodox to perform it there. If you're laying on your back and your head is kind of falling back like this and that's not comfortable to start with, put a little pillow or towel under your head so that your face can look at the ceiling more directly. And then when you practice the motion, pay attention to how your neck feels, and maybe don't go as high as you think you should, right? Because the higher you go, the more more pressure goes onto your neck and upper back, and that's kind of not dangerous, but could be a place of compression and some tension is what I'd say to that. It may also be harder to breathe, right? All right, now that's the upper body. The arms are lying by your side. You can have your palms facing up, palms facing you, palms facing down. The arms can be a little further away, which is fine, or closer to you. If they are further away from you, I do recommend your palms face up, because if your palms are facing down and you roll up, that may not be the safest, most comfortable place for your shoulder joint to be. So it's fine to be wide. Just have your palms up, or pinky finger on the floor, just for your shoulder girdle comfortability. You can also have your elbows be bent, right? If straight arms doesn't work for you, elbows being bent is fine, as long as you're comfortable. Now, legs are hip distance apart, which means the feet are under the hips directly. They're not touching each other. They're not on the outside of the line of your hips. They're in line with your hips directly. Starting with your feet on the floor is actually an aggressive place to start. If you have a piece of furniture like a couch that's up against a wall, or something that when you push on it doesn't move easily, you're going to put your feet up on the edge of that surface. So I'd put my feet on the edge, the sole of my foot on the edge of the couch cushion, right? That will be a more supportive place to practice this series. The lower that surface is to the floor, the more aggressive, the more difficult it is to exercise accurately for the largest population, right? But I'm going to demonstrate it with my feet on the floor, because that's what many people may not have access to, an elevated surface, right? Now the next thing to focus on is you are pushing down with your feet. Something that people tend to do, which is not right or wrong, it's just a different emphasis, is they push their feet away from them as if they would slide on the floor, versus pushing the floor down actively. Right? Those are slightly different emphasis. So you're going to think of pushing the floor down versus pushing your feet out, right? That's a big thing to think about as well. So once you've got your mind around those basics, this is why there's a lot involved with this exercise. It's why I don't show it a lot on this channel. It just needs a lot of conversation to be for a large population of people. Start by pushing your feet down, and then release that. That's all you do. Again, just push your feet down against the floor. Return. Pretend your feet are on two elevated buttons that must be pushed downwards, right? Your back of the hips stay on the floor, and then release. Just push the feet down. You could think of pulling your heels a little towards your bum as you push down, to help that sensation of pushing down versus pushing out. So think of pulling your heels towards you as you push down, just to help get that sense of less pushing away from you, right? Now, you're going to round your lower back, which means you're trying to make the space between your lower back and the floor decrease. Your lower back may not come on the floor, but it comes lower to the floor, and push your feet down. And then release that. Push your feet down and round your lower back towards the floor, keeping the hips on the ground. Great job. And then release. Try not to let your knees go apart or together, just stay in line. Again, push your feet down, try and round your lower back towards the floor, which means your lower back comes closer to the floor. As you release, your lower back releases away from the floor. It's a small motion, it's not very big. Again, round, try to reach your lower back towards the floor gently, and then release one more time. Again, exhale to round, allow your lower back to round some. And then release. This little round will help your lower back not overarch when you drive your hips up for the largest population of people. Now you're going to press down, round your lower back. Now push down more and try to lift just the hips up off the floor a little bit, relaxing your shoulders. Watch out for tension to your neck and shoulders. Then release all the way down and rest. Great job. Breathing. Again, press down, lower back towards the floor. Now do more pressing down with your feet and try and lift the hips just a little bit off the floor, relaxing. So you are using your arms a bit here. Just make sure that when you use your arms, you don't bring your shoulders to your chest. Release all the way down. One more time. Again, press down, rounding. Press down more. So when I push with my arms, I want to make sure that the front of my shoulders don't come forward towards my throat or breastbone. They can stay wide, and I'm using the back of the shoulder with the whole arm pressing versus the front of the shoulder coming forward, which is just a different emphasis. And release all the way down and rest. So let's go over those shoulders a bit because it's a big question people often have. When you're pressing down, I want you to think of pressing the floor down without the shoulders coming forward towards your chest or towards each other, right? Think of pressing the back of your shoulder a little bit into the floor. So think of pushing the back of your palm or pinky finger, back of the elbow, that's pointing down if it is, and the back of the shoulder as well. People tend to push down with their elbows, and that brings the shoulders forward. So really push with the back of the shoulder and elbow. Release it. Let's try it again. Everything else stays still. Just push with the back of the shoulder towards the floor and the elbow pushing against the floor. Release, and feel that difference there, right? Back of the shoulder presses to the floor, elbow presses to the floor. You might feel your upper back move slightly. That's okay. Release one more time. Again, back of the shoulder and the elbow pressing. Great job. Release. Let's do the opposite. Let's press just with your elbow, and you can see what happens to your shoulder girdle there. And then release. Press just with the elbow. The shoulders are going to want to move away from the floor, and release. It's not wrong. It's just not a different exercise. Press the elbow down and bring your shoulders forward. Great job. I want you to use the back of your body in a fully functioning manner, and to understand that when your shoulders come forward and you're up with the hips, that could put a bit of compression and tension into your neck and throat, and that's not the goal. That's the major reason for that. All right, let's go back to it. Here we go. When you're ready, press your feet down, round your lower, push the back of the elbow and shoulder to the floor, and try to drive the hips up just a little bit. I'm just demonstrating with my hands so you know it's not very high. Then easy release all the way down. Great job. Again, round your lower, push your feet, elbow, and back of the shoulder to the floor, and try and drive the hips up a little bit. Really great job. And then release down. One more time. Push with the back of the shoulder and elbow and feet, rounding your lower back to the floor, and do more of that to drive the hips up. You got it. And then release all the way up. So we added those components together. Now, things to think about here. The part of your body that drives the hips up is the back of your hips. It is not your back lifting, not your lower back lifting, right? Your lower back lifting creates a lot of arch to your lower back, and that's fine, but that's a different exercise, right? For this one, we're trying to put the emphasis on the back of the hips, your tuchus, your popo, your derriere, your hiney, to drive the hips. Your major propulsion is the back of your hips, right? Yes, the legs are pushing. Yes, the arms are pressing, but the main driver is the back of your hips, right? And that can be tough to feel if you're not used to that kind of thinking about your body like that. Totally fine. Realize that when you're pushing down, if what you feel is your lower back, try not to go so high, right? Only go as far up as you can not feel your lower back arching or activating markedly, right? So when you roll up, your lower back goes lower to the floor. That's a feeling. As you press down and drive up, that feeling of support to your lower back and not stress, non-strain, should maintain itself as you come up and down. If the sensation changes to activation or other feelings of engagement, that's high enough, and don't go higher than that until you can get the back of your legs and hips and arms and shoulders to work more effectively, and your lower back to be less active as the motivator there. That's why rounding your lower back to the floor can help a lot of people out there, because people generally arch their lower back a lot to lift the hips up. Just because they're like they're aiming for a target, they know it's somewhere here, and it's hard to be specific. So press your feet down, round your lower, push the back of the shoulder and arm to the floor, then press down with the feet more to drive the hips. Now, you can go a little higher if you want to, so long as all of those other bases are covered, right? Your neck is comfortable, your lower back is comfortable, you're pushing down, not away with your feet, and it's the back of the hips that are the prime mover. You may not feel that, but that's the goal, right? And then slowly roll all the way down. Great job there. Again, press down, rounding your spine, push down with the shoulder, back of the shoulder, elbow and feet, push down to lift up a little bit, and then you can stay there, or you can push up a little bit more as far as you have comfort. Easy breathe. Again, really think of pushing the floor down. You can think of pulling your heels towards your bum a bit if that helps you, but that may be too much because some people are going to cramp with that kind of cue. Then slowly undulate and release all the way down. Really good job. Again, press down with the feet, round your lower back, elbows and shoulders press to the floor behind you, lift up a little bit, and if you can, really push down more to drive the hips up. Remember, it's a driving of the hips, not a hip lift, it's a press. It's a driving of the hips by pushing the floor down, and slowly undulate all the way down. Great job. Let's do 5 more. Again, easy breathe, round, press down with the palms, arms, shoulders, feet, round, hips lift a little bit. You can stay there and just squeeze more or drive up higher if your lower back is comfortable here. Easy breathe. Try not to let the knees go apart or together. Just drive forward, down towards the floor. Then slowly release all the way down to the ground. You've got 4 more to go. Again, press your feet, elbows back of the shoulder down, lower back rounds towards the floor, comes closer. Then you push down more to lift a little bit, or if you can, without pain or strain to your neck or any other part of your body, drive to roll up. Make sure there's no tension to the front of your shoulders here. You're pushing down with the back of the shoulder and elbow and feet, and slowly undulate, release all the way down. Just 3 more. Again, breathe, press down to roll up, easy, gently articulate the hips up away from the floor. Make sure the focus is on the back of the hips, not your lower back lifting or pushing. And easy, slowly breathe, undulate all the way down. Just 2 more to go. You're doing really well. Take a break, it's okay. Press down strongly with the elbow, back of the shoulder and feet, round your lower back. Push down more to roll the hips up. Really great job. Big breath in. And slowly roll all the way. Now, I haven't talked about how high to go, right? Only go as far as you have all those other bases covered. Otherwise, just press up, right? As far as you have comfort. You shouldn't have strain to your neck or upper back. Easy, press down strongly to roll up. So if your feet are higher, that's going to increase the pressure to your upper back and neck. So only go as far as you have personal comfort, and all those other bases are covered. If your feet are on that elevated surface, you're again always pushing down. You're never pushing away from you. For this version, there's other versions that people will teach you. That's totally fine. I'm not saying that they're wrong, but what we're doing today is this version specifically, not because it's better or worse, but just because I have found for the larger population, this is what works the most for the largest amount of people. Great job. Arms wide apart, feet stay where they are. Let your knees twist to the same side. Really good job. Eyes up to the sky. Breathing in. And then return center. And then twist and rotate the other way. Really great job. Easy. Breathing in. And then return center. Again, easy. Twist and rotate. Really great job. Breathing in. Come center. Other way. Easy. Twist and rotate. Breathing in. Really great job. And then return center. Now you may see people put like a ball or a yoga block between their legs. That can help with inner leg and abdominal engagement, like the front of your body. But that makes it harder for your pelvis can make it harder for your pelvis and femur to find articulation there, right? The squeezing of something can help give support, but it can, for some people, make it harder to support your lower back and to let the femur and pelvis move in a rhythm, in a pattern that helps support the lower back. You can also conversely put like a band on the outside legs and push apart a bit. That will help the articulation of the femur and the hip socket a lot and help get the outer hip to engage and back of the hip to engage more. The thing to be aware of there is that you're not pushing out so far that your knees splay apart, right? You're pushing apart, the legs open a bit, but not so far that your knees go on the outside of the hips, right? That's what I'd say about that. So if it's hard for you, you can put a band on the outside of your thighs, like a loop band, what I recommend for a lot of people. That may help with feelings of engagement, right? You can put something between your legs. That will help with feelings of engagement, but it can make it challenging for the pelvis and femur to articulate for some people. That's what I'd say. All right, there you go. I hope you enjoyed this. My name is Eric. This is Nucleus Strength. Look forward to getting stronger with you in the future. Yours in good health. Take care.